And good afternoon, everyone. TJ All's I-45 Now, Galveston Now, presenting yet another edition of Health Care Unmasked, presented by UTMB Health. Sorry, we're a little bit late with joining you here today. We had some technical issues, and we've gotten those worked out now, but we're glad to have you along. It is summertime, and a lot of folks have been out and about and out in the sun. And one of the big things we always want to talk about this time of year, as the sun gets a lot hotter, but folks are heading to the beach and the like, is how to take care of your skin, not only when you're out sunbathing, but everyday use. And we have one of the best folks to talk to us about that. It's Dr. Kathleen Kroger, who's a dermatologist from UTMB Health, focuses on general, pediatric, and complex medical and cosmetic dermatology. That includes, by the way, Botox fillers and lasers. We'll talk about that at another subject down the line there too. And it's great. Now, she is at UTMB Health, but forgive her, she went to the Texas A&M Health Science Center, but we're glad to have her at UTMB Health now. So, Dr. Kroger, thanks for coming on with us. We appreciate you.
Yeah, thank you for having me. I'm excited to be here today.
It's a topic we hear a lot of warnings about when it comes to summertime for that. So let me just kind of throw this out to you is that while we hear about it summertime, because that we know that's when most times folks are going to be out, but really maintaining good health care for your skin is something that should be something followed year round, should it not?
Yeah, that's exactly what I was going to bring up today is, really your skincare routine should be consistent throughout the year. What you do in the summertime versus the wintertime should be the same, because we're still getting UV rays, even on the cloudy days, in the fall and winter, you're still getting about 80% of the rays that come through. And most of those UV rays are UVA and UVB rays. And so UVB ones are the ones that we think tend to cause more skin cancers. And then UVA tends to cause a lot more skin aging. So, you really want to protect yourself from both of those types of rays. And those are really present throughout the year. So I'm all about keeping the same routine, from January all the way till December.
And I was interested in this topic because as you and I talked before we went on the air here today, I'll be showing off some of what I have in here. So, folks, you can hear from me what I use. And if the expert actually thinks what I have actually is worth it. You brought up a good point here, though, is that there's one thing we hear about a lot about skin cancer, but skin aging. That's something that a lot of folks, I don't think, pay attention to a lot of times. Is they'll look older the more they don't protect themselves. Talk about that a little bit. We have actually kind of an example to talk about as you're talking through this as well.
Yeah, so once you pull up this picture, but really, so sun, I have a lot of patients actually that come to see me because a big part of my practice is doing cosmetics. And so they want to come in and, ask about Botox and filler or like the best skincare regimen. And I really tell them that the most important thing is sun protection. They've done studies where, they compared one person who wore sunscreen daily versus someone who doesn't. And they showed about 25% more signs of skin aging if you didn't wear sunscreen. So for me, the biggest thing is prevention, just like any other part of someone's health, is to really protect your skin. So that to me is probably the most cost-saving thing you can do to keep you looking younger and to prevent, signs of aging that a lot of us try to battle as we get older.
And one of the things, too, I'm going to bring up a photo you sent over to us to share here.
Yeah.
It's interesting is looking at this gentleman here is a truck driver. Talk about this here because again, this is not, we think, I know most people think about, okay, when I go out to the beach or if I'm out doing yard work or something like that, that's when I need to be careful. This situation here, this is an everyday thing for him. And we can see the dual effects here. Talk about what we're looking at here.
Sure. So this photo was published years ago in the New England Journal of Medicine. It was one of their clinical images. And I think it might have even went viral because a lot of different publications and newspapers were actually republishing this photo because the change is so dramatic. Looking at the left side, so it'd be your right side when looking at the photo. This is actually a truck driver. So he is getting constant sun, as part of his job through that left side, through the window. And so unfortunately, windshields don't block UVA very well. And so this patient here was getting all that sun exposure over, I think he said he was a truck driver for over close to 30 years. And so this is just almost like a nice split face where you can see the right side got less, sun exposure compared to the left. And you can see just the dramatic change in the face in terms of just the skin thickness, the amount of wrinkling and laxity that you see in the skin. And so it's funny because this is one of my most memorable moments actually in residency. One of my mentors, I actually did my residency training at UT Houston, MD Anderson, here in our med center. And this was one of the first photos that she showed me. And this has just really stuck with me. And so a big part of my, visits with my patients, at every clinic visit, I talk about prevention. Because if we can prevent a lot of these changes, in addition to, preventing development of skin cancers, really overall better for someone's health.
And this is striking because, as I said, I'm showing the two. I was zoomed in here to show this for our viewers here. So this is the left side of his face. This is facing the window here.
Exactly.
As he's driving hours on end and coming through, no protection there. You can not only see the wrinkles, but some scarring here as well. And then you go to this other side, and it's unblemished, essentially. And the difference in the aging that it causes there. In this photo, do you remember from when this photo was released how old he was?
It's over. I think it was over 10 years ago. I can actually pull this up. I have that here.
To give folks a perspective here, that this is not a super old guy here at all, and you can just see the difference between the two sides of the face. Even if you look closely in the nose area, you can see kind of a bulbous go up on one side that seems to be related to that. And again, so this goes into how you and I just started this conversation, is that this is an everyday thing that folks need to be paying attention to, not just a summertime thing. So even though this is the first time we've addressed this during that time.
Yeah. So looking at it, it looks like it came out, this clinical image, back in 2012. So really not that long ago. And this gentleman is 68. So looking at one side of the face, he looks a lot older than 68, compared to the other side of his face. So, I mean,
it looks like he's in his 80s, like you expect there. And the other side closer to that, the 60s age there. So that was when it was a striking image that you sent over. So, folks, this is a good thing to know. And I'm one of those, by the way, and not just for face. I'm one of those when I'm driving, my arm is always up on the windshield. And I always notice too, like at the end of a long drive or something, I'll have that heat feel there, and I'll see like a red streak from there. And I don't think about that at the time I'm driving. But so for someone like that, just your everyday use, what should we be doing everyday use to protect ourselves?
Yeah, of course. So I tell patients, no matter what you're doing, because I get this question all the time. I ask my patients, are you wearing sunscreen every day? And they say, well, doc, I don't really go outside. But then I asked him, well, you drove here to see me in clinic. So, that was getting sun exposure on your car right here. You go to the grocery store, you go to work, all that is technically sun exposure. And so really a part of everyone's skincare regimen should be wearing at least a sunscreen SPF, at least 30 to 50 every single day. The main areas I really try to focus on is really the arms, the face, neck, and chest, and especially for men, if they are starting to lose a little bit of hair on their scalp, also to make sure they cover the top of their scalp and also their ears. So for men, the ears and the back of the neck, those are areas that they tend to forget to cover, because men will throw on a baseball cap and think, they're good, that they don't need to apply any sunscreen, but that baseball cap really doesn't cover the back of the neck and the ears as well. So those are kind of the main areas that I like to focus on. And then, of course, if you are going to be outdoors for prolonged periods of time, to make sure you cover all those areas that are exposed.
And when you talk about the SPF and minimum of 30, that gets into one of the things we talked about is that we see the numbers, we see the hype on it and the like. And I was pointing out, this is actually, and you're going to settle an argument, I think, for me. So here's my wife's favorite. It's Neutrogena, and it's 70 SPF. Okay. Now, I use 30 most of the time, but I use a spray. Now, this is a 50 because I knew I was going to be a little more exposed on a recent trip. So this is a 50 that I have here.
Sure.
Is there really a difference between these two? First, on SPF, let's talk about that before we get to talking to spray versus lotion, because I know there's a big debate about that too sometimes with people.
So SPF stands for sun protective factor, and so you'll see anything on the shelves ranging from 15 to 100. And I always hear my patients, they want to grab the 100 because usually if it's a higher number, it must mean it's better. But in this case, it actually isn't. So the number basically represents, for example, if you have an SPF 50, it just means it'll take you 50 times as longer to burn for your skin to turn red compared to someone who's not wearing sunscreen. And when they actually compared the SPFs, really an SPF 30, you're blocking 97% of the UV rays if you're using it correctly. And you really only bump that up to about 99% if you use an SPF of 100. And SPF 50 is about 98%. So you're really, that big increase in the number of SPF is really only giving you an additional 1, maybe 2% additional coverage. So
gotcha.
I wouldn't focus on that number so much, more than at least just applying an SPF 30 to 50 is really sufficient.
Yeah. So again, is that a marketing thing? Just the companies come out, the higher the number, folks think, oh, that's the better protection?
I think so, because, to be honest, even at SPF 100, there's no sunscreen out there that can block 100% of UV rays. So I think it is just to kind of have more additional options out there. But really, and sometimes they are a little bit more expensive, the higher SPF branded sunscreen. So I just tell my patients at least an SPF 30 to 50 and reapply every 2 hours if you're going to be outside for longer. And that is the most important. So in your case, PJ, I think for the number, you can win against your wife for that.
Okay, so I can win that because, as I said, and most of the time, like if I'm just hanging out, at the pool or just outside in the lawn or something, I'm going with the 30. But if I'm on a trip where I know I'm going to be out a lot, particularly over several days, I bring the 50 with me.
Yeah,
my wife.
I was going to say my only comment is your wife wins that. The aerosols I don't recommend as much because you're not getting as even coverage.
Okay.
So that's one thing that a lot of us dermatologists recommend is either the lotion so that you can apply it on very evenly. And most people don't apply enough. So really every application you need to do about an ounce, which for most people, if you just think about a shot glass, so that whole shot glass of sunscreen is how much you're supposed to apply.
So really, even then, just the dab is not what you should be doing. I mean, whole shot. I think you put that best of anyone I've ever heard bring this up before, Doc, is to say you need a shot glass of SPF lotion to put out there, right? I mean, that's someone can visualize that, so that's great. I do appreciate that. So anyway, that's something else. Now, one of the things is while I'm asking about that, and I'm going to say if you because some products here recently, because of minute amounts of benzene had come in there. Trisha Clement, thanks Trisha for this. This is actually a good one. I was going to ask you this a little bit later. Said, have been recently recalled and make sure your screen doesn't contain benzene. So what do you say there? Because she's like saying, don't put products on your skin that cause cancer. Another one. Yeah. What cautions do you have for folks? Because that's one of the things we talk about is you got to look at what's on the back here as much as anything, right?
Yeah, so not all sunscreens are created equal. And so this just recently came out and it's been a lot in the news. And a lot of us dermatologists have been discussing it and how are we going to counsel patients about it? Because benzene is a known carcinogen that's been linked to certain cancers, specifically leukemia. And so just to kind of reassure patients, in general, I tend to recommend more physical sunscreens, or we call mineral-based sunscreens that contain zinc and titanium dioxide. If you look, you can actually search online for the list of sunscreens that were without benzene. And it was done, I think, a study by Valisure, which is an independent pharmaceutical company that went in to detect, trace amounts of benzene. And so there is a safe list that they have online of sunscreens that had it and didn't have it. And so a lot of my patients, I've kind of been referring to that list. But as a general rule, most of the sunscreens on that list that contained benzenes were actually chemical sunscreens. So those are the ones that have the names like avobenzone or oxybenzone. Basically, if it doesn't say zinc or titanium dioxide, those are the chemical sunscreens, and they tended to be more likely to contain benzene. And also aerosols tend to be more likely to contain benzene. So TJ, you might
you got me twice, Dr. Kroger.
Yeah. And I think Johnson & Johnson just recently recalled 4, and they said it was, I believe, due to a batch error that they had trace amounts, but the 4 I think that they recalled were all aerosols. So I tend to recommend physical-based sunscreens that contain zinc and titanium dioxide, and ones that are lotion, so not aerosols. And those tend to be a lot more safe. They're also less irritating, so they don't burn the eye as much. And also, to kind of put it in perspective, you do get exposed to benzene just naturally in the environment. So, when you're at a gas station, I kind of like to use this comparison. Another dermatologist had kind of posted it on her social media page, but you get about 15 times the amount of exposure to benzene at a gas station than you do in a whole bottle sunscreen. So, if you can find an alternative without the benzene, which there are plenty out there, I'd say go ahead and do that. And that's the safest route to do. But just kind of wanted to put that in perspective.
Yeah, and that's good, because as you were telling that, this is the first I've heard about that. So like what I was, and I'll at least use this against my wife, I guess. It does say here, 4% oxybenzone. And that's one of the ingredients you warned about in there. But those mineral-based ones. So really go to the mineral-based lotions with a good SPF count of at least 30, as you said. Those are probably the best routes to go.
And those are the ones that are safe. If you like scuba diving or snorkeling, those are the ones that are allowed, especially in places like Australia. The chemical sunscreens are the ones they worry about with the coral reef and everything. So you'll find most dermatologists end up recommending zinc. They do tend to be a little bit more of that pasty, thick white color, and that's why most people end up liking chemical sunscreens more. But they have come out with more tinted sunscreens that kind of have a little bit of color to them for our darker skin type patients. And so there are definitely more alternatives out there. So I just recommend you go see your dermatologist and really ask them what they recommend.
And that goes to another question, because how about the difference between adults and children? Here, Jacqueline Den asked this question: is there a different sunscreen or ingredient you should or shouldn't use when with young children? She's talking about here to take a look at.
Yeah, that's a great question. So the most important thing is the same thing as the mineral-based sunscreens have been shown to be safe. You probably have a lot of Google savvy viewers out there as well. There was a study last year that showed, the chemical sunscreens are actually absorbed in the body. But, we don't know if those levels are, detrimental to people's health. But, generally the FDA regards the mineral-based sunscreens as safe. And so really for our pediatric patients, especially our younger patients, to go ahead and just buy the zinc-based sunscreen for the entire family. I think most people say try to avoid sunlight for babies less than 6 months. So I generally tell parents to try to keep babies less than 6 months old out of direct sunlight if they can.
One of the things too that you talk about is using UPF clothing. Can you talk, because folks may not know exactly, UPF clothing, what that is. Can you explain what that is?
Yeah, I'm so glad you asked that. So I love UPF clothing. I tell my patients, apply a shot glass of sunscreen all over you every 2 hours for the entire duration. That's a lot of work. It's a lot to expect for someone to do. And the nice thing is that they've come out with kind of a rating for clothing called UPF, which stands for ultraviolet protective factor. And it basically correlates to the same protection that you would get with sunscreen, but you don't have to reapply because you're wearing this protective clothing the entire time. So they have ratings anywhere from 30 to 50 usually, and 50 is the highest for UPF. And so that's what I usually recommend patients look for. And so if you have a UPF clothing of about 50, you're basically blocking UV rays at about 98%, and you're not having to reapply every 2 hours. So for a lot of my patients, I say go ahead and buy that, and you'll kind of find them under the name rash guards is what most people will look for. And there are definitely a lot of brands out there. I'll even tell patients to look for them on Amazon. They're that readily available.
And in fact, that again, this is my prop day. I had shown, because I'm a big fan of the SPF clothing myself, or UPF clothing as well. And this, and as I said, for folks have it, this is a liner that's inside my fishing shirt here. That you can't see it that well on screen, but it is a lining, and it has an SPF protection, or UPF protection of equivalent to an SPF of 50 that we have here. And wear this constantly, and wear versions of these. In fact, this is one of our folks that support us back home. You get the Texas flag on it, or US flag, or those type of things.
Yeah, I tell a lot of my patients, they make really nice patterns. For a lot of my women, they're really beautiful shirts. So,
yeah,
I mean, I will wear that over my swimsuit, and I'm not having to reapply, and I don't burn. So the only other thing I kind of add along with UPF clothing is to make sure to wear like a broad brim hat, and that way it can be additional protection for your face and your ears and your neck. So.
Right, and that comes into that we'll see folks out with the big sombreros or anything like that as well. I have one of those big hats. I'm not going to bring another prop out, but that has the big brim that goes all the way around, because that really does block. It's a lot better than a ball cap.
Definitely. The ball cap basically is not protecting your lateral face, your ears, or your neck. So.
Well, we got a lot of your fan club coming in here right now too, coming in, including one mom who said, you're the dermatologist for her child and everything else. And if you're just joining us, folks, we're talking about skincare protection here with Dr. Kathleen Kroger, a dermatologist with UTMB Health. I also have one of her patients join us here who went through some treatments here. First, let me get into we were talking about the most common type of skin cancer that's out there, and I'm gonna bring up one of the images you sent us. But can you explain to folks, what you see most often when dealing with skin issues, the most common?
So I just want to let people know just how common skin cancer is. Skin cancer is the most common cancer in the U.S. Even if you combined all other types of skin cancer, all other types of cancers, skin cancer is still the most common. And so you have basically the three most common skin cancers are basal cell carcinomas, squamous cell carcinomas, and melanoma. And I know a lot of people hear about melanoma, but the other two that I mentioned, the basal cell and the squamous cells, are actually the most common, with close to 6 million people being diagnosed yearly with those skin cancers, and it's all related to sun exposure. And so here right now, I kind of put a picture up there. I thought it'd be great for your viewers to see examples of skin cancers, but I'll be honest, skin cancers a lot of times can look like anything. It can look like a bug bite that just hasn't gone away, or a scratch or an ulcer that just hasn't healed. But a lot of times, in this case, you can see here, this is actually a basal cell carcinoma on one of my patients that, they let grow for about a year or two. And you can see here, it's a pearly, we call it papule. So any kind of thing that's raised, we call a papule. And so you can see a pearly lesion there. And this is another example of a basal cell. I'm sorry, it's so kind of low power, but if you look closer, thanks, CJ.
Yeah.
But basically, this was.
It went. I need to hold it back. Here we go. There, we're back there.
So this was like a smaller version of a basal cell. So we'd like to catch skin cancers when they're this small, because cure rates are great. Most people have great treatment options for that, and so if you see anything on yourself that's just not healing, that bleeds on its own, or a new growth on your skin, just go ahead and get it checked out, because it could be a skin cancer.
And then here, and you take a look at, and we'll get some more details here. Now, this is the second most common that you do.
This is a squamous cell carcinoma. So this is still due to basically sun exposure and UV exposure over the years. And so this is another example of a skin cancer on my patient. And this one actually grew pretty rapidly, but easily treatable with excision, especially if you come in early. So.
And here, and this is, matter of fact, we're going to bring her in now. This is actually from your patient, Pam Hunter, who's joining us here today. Talk about this and how and what we're looking at here, because this gets into how, when you're looking at someone's skin, and looking at these conditions, of how you're able to kind of narrow in and really get a good idea of what you're dealing with.
TJ, if you pull up, there's a clinical photo of this. I kind of wanted to talk about this first. So yeah, one of my sweetest patient, Miss Hunter, she's joining us here, and she's just calling in today, but she'll kind of talk about her history of melanoma and how I detected that. But her melanoma was actually on her leg. And it looked, like any other possible sunspot on it. But when she came to see me, it had never been there before. And it was it's right there, TJ. Perfect. And
that one right here,
a little bit darker. And so melanomas are the ones that we really worry about because they can spread pretty rapidly. And they've shown if you can catch melanoma and treat them within a month, that you really do decrease the mortality rate. So we take melanoma cancers very seriously. And so this is actually a picture of her melanoma on her leg. It wasn't really raised. It was pretty flat. She had other kind of sunspots on her body. But this one really stuck out because we go over the A, B, C, D, E's for patients with melanoma. So A stands for asymmetry. So if you were to draw a line in half, would the lesion be a little bit asymmetrical? And in this case, it would be. And B stands for border. So instead of being a nice circular lesion, this one does kind of have irregular jagged edges. And C is color. So even with the naked eye, you can see here that there's multiple colors, which is a little bit more concerning. And then D stands for diameter, which anything greater than about the size of a pencil eraser can be concerning as well. And then my last one is the most important one for me, which is E, which is evolution or change. And so I really trust my patients. If you see a lesion growing on you and that it's changing or growing rapidly or bleeding, definitely come in to get it seen. Because about 30% of melanomas will come from a pre-existing mole that you have on your skin. But that means, about 70% come up kind of on their own. So in this case, we took this lesion off. We did a biopsy for Miss Hunter, and luckily for her, it was the early stage of melanoma, so it had not invaded. And if you can catch melanoma that early, the survival rate, I should say, is over 99%. But if you delay the diagnosis or you don't come in to get checked, unfortunately, that decreases significantly. So once it started to invade in the lymph node, survival at 5 years goes down to about a little over 65%, and even lower to about 20% if it metastasizes. So if we can catch these melanomas early, that's always, our goal and for our patients.
And this image here, because this comes into the kind of a tool you use of this. What are we looking at here specifically?
So, in the last 20 years or so, there's been a new tool that a lot of us dermatologists use. And most dermatologists, they pulled a lot of us, and over 80% of us use this tool now. It's called Dermoscopy. So if you ever go in to get skin checks and you see us holding this handheld light, it's basically like a magnifying glass with polarized light. And so, what we see with our naked eye is actually a reflection of light off the skin. But when we use polarized light, it's able to penetrate deeper in the skin. And we're able to see, different pigment patterns better, and also blood vessels. And so we use those as signs of, something worrisome or something less concerning. So this is actually a dermoscopic picture of Miss Hunter's melanoma. And as you can see here, you can see those kind of scattered darker areas of pigmentation, and they're actually off to one side. They're not evenly distributed throughout. And so to me, when I saw that, not only was it concerning clinically, but also dermoscopically, it was concerning. And so luckily we took that off for her, and we're able to diagnose it as a pretty early melanoma.
Let me ask you this, though, because it's one thing coming in to see you about this, but what can people be doing at home to be looking at? Because I have to admit to you, is this whole time, and that you've been mentioning this, I've been staring at my arms and my hands like, hey, do I have something like that? I have a mole. It's over on an elbow here, and I'm checking it out. Okay, it looks like the same size. What should people be doing at home just to check? And we don't want to panic anyone, but what should they be doing to kind of check and say, all right, well, this looks different, and now I need to go see Dr. Kroger?
Sure. So my biggest thing is one, first assess, how at risk you are for skin cancer. So the people at risk for me that are need to see a dermatologist anyway before even looking at your skin are people with family history of melanoma. So if you have a first degree relative with melanoma, you really should be getting annual skin checks. Two is if for any reason you're immunocompromised or a transplant patient, that also puts you at higher risk for skin cancer. A third thing to consider is, how much sun exposure have you had over the years? So the most important UV damage that you actually get is when you're younger. So I appreciate that question earlier about, asking how to protect, your babies. But blistering sunburns, all it takes is one in childhood to really increase your melanoma risk. And then 5 sunburns, over the course of your life to really double your risk of melanoma. So kind of ask yourself, have you had those blistering sunburns or severe sunburns over the years? And then the last thing for me is really tanning bed use. So there's been a lot of studies that show 1 tanning bed use. And a lot of my patients will say, doc, that was, 30 years ago or when I was in high school. But really all it takes is 1 tanning bed use to increase your risk of melanoma. And so if you have any of those risk factors, go ahead and get seen by a dermatologist. And then in terms of what you could do at home, I do recommend looking at your skin and getting to know what moles and spots that you have on your body. So looking mainly at your face and then neck and chest area, and as well as your backside. So a lot of people don't look at their buttock area as much as well as your hands and feet. Because patients of darker skin types actually can get melanoma most commonly on their hands and feet and nails. So those are areas that you definitely want to keep an eye on.
And that was going to lead to the next question, because there's kind of a myth out there that our darker skin types are less likely to get skin cancer. That's not true.
No, everyone is at risk for getting skin cancer. It is true that Caucasian patients are at higher risk. They're 70 times more likely to get a skin cancer than our darker skin type patients, our Black patients, Asian patients, Hispanic patients. And that's only because naturally we have more melanin in our skin. That's actually what gives us the pigment in our skin. And that does absorb and deflect UV rays better. And so naturally, if you do have a darker skin type, you have a little bit more natural protection, but you're still getting those UV rays. So we frequently do see basal cell and squamous cells in our darker skin type patients. And then melanoma, as I mentioned earlier, definitely you can get in darker skin type patients, specifically a type that tends to be on the hands and feet. So I like to mention that. And that was a big reason why I went into dermatology. My grandfather actually had melanoma on his foot. And so for me, a big thing was public education, especially for those patients that, didn't even realize you could get skin cancer. So.
Great. We've shown off another version of her body with the skin. Let's have Pam Hunter now join us, and she's going to join us by phone. She's actually on the phone through Dr. Kroger's office here. Pam, can you hear me? Okay.
Yes. Hi, Dr. Kroger.
Hi, Miss Hunter. How are you?
I'm doing great.
So Pam, share with us, because we've been showing the whole world your what you had to deal with your skin issues. Why don't you tell us about how that story goes? Because this is not, you're a nurse, and so it's not like you take any of this lightly. You make sure you're checking on your health and talk about what you had done before, prevention, everything else, and then also when you found out, that hey, you've got a trouble spot here.
Well, I'm 71, so when I was growing up, everybody just laid in the sun and no sunscreen. So I was always burned because I'm very light complected. But after I was a nurse, I started really paying attention, and I had a cousin that had melanoma between her toes, and that really got my attention. I didn't realize that you could, and she passed away because it metastasized. And so I really pay a lot of attention to my skin and my loved ones and friends as well. And I've even been known at a grocery store to tell the person in front of me, you need to get that checked on your neck.
So someone's going down the bakery aisle and you see a little spot on their neck and you come up to them and say, hey, you need to go.
Yes, I really do, because it's really important and people don't really realize how significant it can be.
Well, and again, as I said, I think, we've heard this information over the years, but I don't know how serious. I mean, and when Dr. Kroger had pointed out that skin cancer is, tops them all out there, particularly too when you're talking about skin cancer. Also, the largest organ we have is the skin. And you said you advise, you were pursued, but talk about your own experience. How did you come across? You say you have you go in annually, no matter what, to Dr. Kroger.
Yes, I see her annually, and she noticed. First of all, it was kind of a weird looking mole because it was a light mole, and then this dark mole showed up like on top of it. And she looked at that and she said she wanted to get a biopsy. I said, of course. And within next day, she told me it was melanoma. Within a few days, she excised it and did a skin graft. And I really believe she saved my life, because it's not something that I would have thought would have been a melanoma had I not gone in. So I'm forever grateful.
And Dr. Kroger, how large actually was this melanoma that was on her leg?
Oh, it was very small. It was about 5 millimeters, so less than a centimeter large. So very, very small. So easily missed. And that's why, as dermatologists, we go the training that we do to kind of help catch things that, sometimes patients don't see. But, I always encourage patients to be your own advocate. Your skin. So if you see anything changing, like how Ms. Hunter saw that, a darker spot had come up, to definitely go see someone.
Pam, you go in once a year. Was that a regular habit beforehand, or did you make sure it's once a year after this was discovered?
Well, it's been a regular habit because, like I said, I'm very fair-skinned. Sunburned so many times in my life, I can't tell you. And I'm immune compromised. And one of the things since I had that excised, I see Dr. Kroger every 3 months, just to keep a check on everything. And that was one of the things that impressed me so much about her, is she was so very thorough. Because talking to some of my friends, their dermatologists don't even have them put gown on. So they just look at them through their shirt, to unbutton their shirt and things like that. And you have to really be your advocate to take care of yourself and make sure that you have a good doctor that takes care of you.
Yeah, you're not alone, Pam, as you're seeing on screen now. I mean, the Dr. Kroger fan club has come out in full force here today, coming out there. And
I love my patients. So.
And we should point out, Pam, in your note to me on this is that you trust Dr. Kroger so much, and sorry, Dr. Kroger, we don't want to get you too big of a head here, but Pam is telling us here she's out there. She goes 100 miles just to see you, right, Pam?
That's correct.
Wow.
That's correct.
I knew you went far. I didn't realize it was 100 miles.
Oh yeah, one way.
One way. So 100 miles to come see you, and another 100 miles to head on home. So Pam, having gone through this, being a nurse, you have a different perspective of this, not only as a patient, but also as a medical professional. What advice do you give to people on particularly this particular skincare and watching out for it? Because as you said, if you don't find that, you think your life was saved by treating this one area on your leg.
Yes. What I tell my friends, because I read all the time, even though I'm not a nurse anymore. Well, I'll always be a nurse, but I'm retired. I read everything I can get my hands on. And talking to my friends and family, the number one thing is they're almost always afraid to speak up to the doctor. If they don't feel comfortable with the doctor, I said, well, change doctors. And make sure that they are make notes to what you're going to ask them, and make sure that they're doing what they should be doing to check you out completely. Because the melanoma that I had could have easily been missed if someone just gave me a kick overall.
Yeah.
So I really believe in taking care of yourself and watching out for yourself.
Yeah, it's definitely is to watch out for yourself, no doubt about it. And so Pam Hunter, patient of Dr. Kroger's, is on a retire and as the nephew of a nurse and the son-in-law of a nurse, I will point out, you're right. You don't retire as a nurse. You just don't go to work every day. It's like you're a nurse and a nurse forever from there. And
right.
I'm sure the folks in the grocery store now are really enjoy it. Now they have a little bit, if they're watching back in your hometown about that. So, oh, that explains why this lady keeps walking up to me when I'm in the milk section and saying, hey, you need to get your neck checked out. Out there. Well, I'm glad you do that, actually, Pam. The other thing, Pam, is that, when you, how sensitive now are you to the skin issues, so that people understand? I would take it you're concerned about it, and you said you were immune compromised, so that's something else you got to double check on. But how sensitive are you to, like, is it every little thing you're like, oh, or is it hey, just take it through the procedure, let me check this, let me go by our markings? How do you approach that?
I just really pay attention to not only, I can't see my hind, my backside, of course, but my significant other, I get him to check me out about once a month, and I do the same for him. And I think it's important for your loved ones to help take care of you, for what you can't see. And I really pay attention. I put sunscreen on every time I go outside. And I do have the UVF shirts that I wear because I garden, and the big hats and everything. So it's just so very important. I just can't stress it enough for people to really pay attention to the sun, because it is getting hotter.
Yeah.
And it's really going to be a problem in the future, I believe, if people really don't take care of the sun, of their skin.
And Dr. Kroger, one of the things is that when we talk about someone, it's getting hotter, as Pam said there, the first place people go is the water. When I was growing up, people said, oh, the water protects you, particularly if you're at the beach. They'll say, oh, no, if you're in the Gulf of Mexico, you're fine. You're not going to get burned from that. That's a myth, right? Is it not?
Yeah, that's definitely a myth. You should definitely be reapplying, and sunscreens will make them water resistant. So they'll test it, and it's good for swimming for about 40 minutes. There are a few that are very water resistant where it's 80 minutes, but really 40 minutes is the best you'll get kind of with sunscreen. And if you are getting out of the water, I know I said reapply every 2 hours, but if you went swimming, you actually need to reapply after getting out of the water once you kind of pat dry. And then wait about 15 to 30 minutes before getting back in again.
Gotcha. Pam, we appreciate you coming on with us today. I know you're up in the Med Center right now in downtown, near downtown Houston. You may have given I had a remark from someone just texted me. You may have provided to the best advice is having your significant other check you out. I think that really thrilled a lot of folks out here. It's a little game that folks can play too, that they get to have some fun with. So any final words from you, Pam, before we move on?
No, just that I am such an advocate for dermatologists and Dr. Kroger especially, because like I said, she is so thorough, and another doctor might have missed this. So I'm forever thankful, and people just need to watch their skin, take care of it.
And it's the one thing probably people don't think enough about. They'll think about, oh, a cold, or they'll think about, oh, I've got an ache or pain. This is the one thing they need to be checking on a regular basis. Pam, thank you for joining us. We appreciate it.
Thank you, TJ, and thank you, Dr. Kroger.
Oh, thank you, Miss Hunter. She's coming up on her 2 year of being melanoma free this fall, so I'm really happy for her. So she gets to see me every 3 months until her 2 year mark, and then we graduate to every 6 months. So she's coming close on that timeline. So,
well, congratulations. Congratulations on that anniversary coming up, Pam.
Thank you very much. Thank you, Dr.
Thank you.
Dr. Kroger, let me ask you on when you find someone like Pam who has a melanoma or some type of spot there, does that mean you've got to be a little more aggressive on following up and treating? Are they more susceptible now to that?
Once you've had one melanoma, you're definitely at higher risk for another one. And so, and also melanoma recurrence tends to happen within those 2 years at a lot higher rate. And so that's why I see patients every 3 months if they've had a melanoma up until about 2 years. And then once they hit that 2-year mark, then we'll move to every 6 months up until about 5 years. And then at that point, I kind of take a look at the patient's skin and say, do we need to keep at every 6 months, for the duration that I'm going to see them, or can we then graduate to once a year? But they basically are going to receive annual skin checks at a minimum after 5 years from their diagnosis. And like Ms. Hunter said, with all of my patients for their full skin checks, I make them get in a gown. That means also taking off their shoes and socks too. So you really want to be looking head to toe. And so I'm also looking in the scalp and looking at people's nails. So it's literally every inch of your body. I even had a patient with an anal melanoma. So in areas that you don't even think to check, it can even happen in sun protected areas as well.
And again, from another patient here, Rhonda Lamore, talking about she's hit her 2-year mark now as well after seeing you as well. We had a question from a viewer earlier. I wanted to bring this up. Jennifer Young asked, "What are your thoughts on taking is it HelioCare supplements in addition to using SPF?" Yeah. I'm not familiar with this topic, and so I wanted to turn it over to you as the expert.
Yeah, so HelioCare is basically a substance derived from a fern plant. And a lot of us dermatologists do like it. We see that it does make people less sensitive to the sun. And some of the HelioCare supplements, I'm not necessarily advertising for them or anything, but it is sometimes a supplement that dermatologists will sell in the office. But you can also get it on Amazon, and they do come with nicotinamide, which is another antioxidant that I actually frequently use to help prevent precancers and skin cancers in a lot of my patients. So I do think it can help. And so some of my patients have found benefits if they know they're going to be going to Hawaii for a vacation where they'll be out for a prolonged period of time. Anecdotally, they have said that they've burned less taking that supplement. So that is an option that's out there.
And that's something, do you find it like a CVS or a Walgreens? Or
I usually don't find it at the regular drugstores. I usually tell patients if they're going to buy it, it's usually at a dermatologist's office or they can buy it on Amazon.
Gotcha. Okay. And now we've talked a lot about, skin cancers and the like, but let's talk about too at UTMB Health, the new aesthetics clinic that you guys have offering there along with the plastic surgery. Talk about that, because this is kind of a new step for UTMB Health on this is overall skincare, not just preventing what could happen down the line, but keeping your skin, but lack of a better term, younger and more supple, I guess is the way to put it. Talk about that.
Yeah, so it's our new plastic surgery and aesthetics clinic, and I'm really honored to be a part of it because, we've always had these services provided through our different specialties, but now it's actually, one clinic site that's multi-specialty based. And so we have plastic surgeon, Dr. Linda Phillips, and then we have Dr. Katie Hicks, who's a facial plastics, and then myself, and then my colleague, Dr. Erica Kelly, who is a dermatologist as well. And so here we kind of wanted a one-stop shop for patients who want to know more about how to better take care of their skin, but also to look into both surgical and non-surgical procedures that you can use to enhance any, anti-aging efforts that you're looking into. So we have a lot of different services. I can probably speak specifically to the dermatological procedures that we do. So we definitely have your Botox, your lasers, chemical peels, microneedling, and fillers.
Talk about microneedling, because until we got into this, preparing for this show, I had really not heard about it much. What is microneedling? Because so folks had not heard it before would have an idea.
Yeah, of course. So microneedling, I love this procedure. I actually do it weekly. And so here at UTMB, it's basically a pen that we roll across the skin that has little needles that they make micro punctures in the skin. And naturally, anytime your skin receives some sort of wound, and so in this case, it's these micro punctures in the skin, it wants to rebuild itself. And so it actually stimulates collagen production. And so for a lot of women, we'll use this to help with skin texture, skin discoloration. But a big thing that I found very helpful is using microneedling for acne scarring. And so my patients will see improvement after just 1 or 2 treatments. And so I've been really happy with having this as part of our regimen as something we can offer to patients.
Of course, I'm familiar with the term dermabrasion and chemical peel, laser genesis. That's been something here as of late that's also kind of I don't want to call it a fad, but that it's that you're seeing more and more advertised in like private clinics and like how does that work? And when do you recommend that for people?
Yeah, so laser genesis is a pretty benign laser treatment that you can honestly, they call them like the lunchtime treatments that you can go in for. So it really helps with stimulating collagen production. And so some people will even do this over scars. So really just like another added tool in our regimen of things to kind of help stimulate collagen production.
And again, it's how long's the clinic been up and running? Where's it located at?
Yeah, so it's been open since about April. And so it's located at our League City clinic off of I-45. So it's on specialty side A. And if you go to that website, it's utmbhealth.com/aesthetics. It'll have all the information on there and our phone number. And I really do recommend, just coming in for a consultation. It's not signing up for any specific procedure. It's really a set time to really discuss the treatment options we have and the goals that you want to achieve. So a lot of my first-time patients, they'll come in really inquiring about fillers and Botox frequently. So. And
you brought it up, Botox. That was the next thing I was going to ask you about it. Is Botox? There are the horror stories we hear out there. Mainly the horror stories we hear is because people are doing this on their own or have gone to people who are not reputable. Talk about Botox, of how that treatment actually works, and when should people really be using it, and when do they need to avoid it? What are the type of things they should not be trying to use Botox for?
Sure. I mean, it's so scary what you can find online now. So I just really recommend that patients stay away from that because there are so many side effects and risks with all these various things. And some can be very detrimental if you're not trained to do that. And so, in our clinic, we're all board certified physicians. And so we've both been trained on the procedure, but also how to handle any complications from procedures. And so, with any procedures, there are always side effects and complications that can arise. So you just want to make sure that you're in good hands with a physician who can take care of you from start to finish. So Botox is, I think, a really neat aesthetic procedure that a lot of people are accustomed to hearing, Botox for fine lines and wrinkles. And so what it is, it's actually a neuromodulator that helps paralyze the muscle from moving. And so I always make this distinction. Botox helps with lines that you get with movement. So we call them dynamic wrinkles, versus filler helps with volume loss. So it's addressing a different thing. So it's usually not, are you getting Botox or filler? It's which one do you need? And sometimes people need both. And so with Botox, it's an easy first aesthetic procedure if you've never had something done before, because it is reversible in that it wears off in about 3 months. So if there's anything that you don't like about it, the effects will go away. But unfortunately, what ends up happening is people love it, and then they unfortunately have to keep up with it every 3 months. I do kind of recommend that if you are in your 30s or 40s and are starting to see those lines in the forehead and kind of right here between your eyebrows, we call that the 11 lines, or like the little smile lines that you get over here, we call these the crow's feet lines, that those are things that you can address with Botox. And so I always say getting started early, more as a prevention, has kind of now been the school of thought. If that you can prevent those lines from coming up in the first place, that's a better approach.
And that's one of the things this clinic can work with you on too, is how to prevent those, so you don't maybe need to, and not knocking Botox or any other treatments you offer because you offer them, but that there are ways that you can, this is more kind of a holistic approach versus a one type of treatment approach, correct?
Exactly. Yeah. And so that's why I said it's one place where I have patients where they come in and they want filler. And instead I say, actually in reality with the end goal that you want, it might be more better to spend your money on a surgical procedure. And the nice part about that is that I have Dr. Phillips and Dr. Hicks who I can refer to at the same clinic location for a consultation. And so you can see their names there, the providers. So that's Dr. Hicks. And so she's our facial plastics surgeon, and she's great.
And forgive me, in the background, you probably hear it, folks, as I'm at the home studio as usual. And the yard guys showed up just in time for the dogs to get going as we're trying to wrap up here. And again, we wanted to recognize Dr. Hicks and Dr. Phillips as well here, work with you. And then Dr. Kelly.
Yeah, Dr. Kelly's wonderful. She's been at UTMB for a long time, and I still constantly learn from her every day. So
yeah. So again, the number 832-505-0777, or you can, we put the link up for everybody earlier too. So you can take a look at that as well along the lines. As we're kind of wrapping up here today, though, speaking of this clinic, a lot of times when we're talking about skincare and the like, even all these images, it's showing women. There are things for men and on this line. So now I'm getting to the point I'm personally interested in. What should men be doing? Because men, I'm rough and I'm tough and everything else. I mean, it's a lot of the same things on preventing skincare. But like at the clinic, what are some of the things that men can come in for that would actually improve for them?
Yeah, you should come see me, TJ.
I am now. Although, even though you burst my bubble on my favorite sunscreen stuff, I'm still going to come see you.
So I definitely have male patients actually that I do cosmetic procedures on. So kind of some examples, Botox is actually one that a lot of men get. So kind of the lines that are right here and kind of the forehead lines, not that we want to completely erase those lines, but for a lot of men, they just want to soften it. They just have such strong facial muscles that they just want to soften that area. And just like with women, as men age, we all have these fat pads in our face that kind of shrink and gravity takes hold and everything kind of shifts down. So that's why everyone starts to see heaviness down here on the lower part of their face. So for men, I do fillers on men as well. It's a different technique in terms of what areas we want to highlight. But definitely do Botox and fillers. And a lot of my male patients who have rosacea will actually come to see me for laser treatment to treat the redness. So definitely everything that we have in our regimen, you can definitely treat our male patients with as well. I think sometimes male patients are a little bit nervous coming in because they think most men don't do it, but in reality they do. So, if it is something that you're considering, just come in and have a conversation with us and we can let you know what's available. Oh, sorry, TJ, I think you're on mute.
Yeah, sorry, but it's getting louder here. As a dermatologist, we talked about the skin cancer and everything else. But for you, what's the most common thing you see when folks come in to talk to you as a doctor?
Yeah, of course. So we see everything. Anything that can happen on the skin, us dermatologists take care of. So kind of the bread and butter are the skin checks and seeing skin cancers, but we see a lot of acne, hair loss, nail disorders. And then we see a lot of rashes too, and even some autoimmune diseases. So we kind of see the whole regimen of things, but anything on your skin is pretty much in the arena of the dermatologist. So, yeah.
Great. Dr. Kathleen Kroger. She is the dermatologist with UTMB Health, and congrats on the new clinic. That's exciting about that. And we had the link online for you to find out more. And obviously, this is always available for replay. We've had several people here tell us already here that they've found this as being one of the more informative shows that we have out there. Do encourage you after hearing it, because my eyes have opened. I've always known about skincare being an important thought, but it's still been kind of an afterthought compared to everything else. It does come down that if you do those annual checkups, at least you're ahead of the game that way. In there, it does come to the question. Let me ask you a question on this, though.
Sure.
how much of this is covered by insurance or not? Because that's going to be a common question. Folks, they'll hear skin and they'll think, okay, no, that's going to be out of the pocket cost. Yeah. Just for folks on the financial end of things, what is covered and what isn't covered by insurance, just on general visits and the like?
Yeah, of course. So most skin checks are covered by insurance, and especially if you have a history of skin cancer and biopsies, we submit to your insurance. So anything that's not cosmetic gets billed to your insurance. So on the aesthetic side, that's completely cash pay. Unfortunately, insurance companies don't cover anything for cosmetic reasons. But everything else that we see, from even hair loss to nail changes to skin checks, all of that is billed to patients' insurances. So
most of what you come in for, your insurance plan should cover it there. And if they have a question, they can give you a call.
Exactly. The billing department's always able to help, and my front desk staff, they're amazing too, so they can let you know your insurance. And if we ever do excisions or procedures, my front desk staff is great. They run the codes to the insurance office, so you kind of expect what your copay will be if you are having a procedure done.
Gotcha. And probably the best tip we got out of the day is, I'm going to brag about this, tips while it was summer. Use mineral-based sunscreen, minimum SPF 30, and a shot glass. That's the best visual, I think. A shot glass every 2 hours when you're out in the sun. And that's simple amount of information, but people can visualize that. And there's plenty of those out there. I mean, maybe y'all need to, not to get into the marketing department, but since I know we've got, some folks on the line with us from there, maybe they need to make a UTMB Health aesthetics clinic shot glasses, so people remember that it comes with the right type of mineral there. So mineral sunscreen from there. So Dr. Kathleen Kroger, dermatologist, UTMB Health. Dr. Kroger, thanks for coming on. Very informative show here today. And I know we're going to have you on multiple more times, because there's so much of this topic we can cover just looking at what's available through the clinic alone. And again, if you have questions of UTMB Health directly on that, you can call 832-505-0777. Their offices are in League City, or you can go online, utmbhealth.com/aesthetics, and you can get in there. Dr. Kroger, thanks for coming on with us. We appreciate it.
Of course. Thank you. This was fun.
I'm glad you had fun with it. And again, thanks to Pam Hunter for coming on with us too. A patient we always appreciate when the patients come on. It's brave of them to do so, but they're helping a whole lot of people. And as we already know, she does that on her own in the grocery store. So if you're ever in a grocery store and a lady comes up to you and says, "Hey, you need to go get that thing on your neck checked out," it's probably Pam Hunter when she's coming up there. So thanks for that. Thanks everyone for watching us. This has been Health Care Unmasked, presented by UTMB Health.